we are getting into the National Health Insurance Authority, who is set to begin that rollout of free dialysis treatment nationwide. Now, what are the modalities and how is the NHIA prepared to deal with emerging issues on this nationwide project? Joining us for a conversation on this is Dr. Dacosta Boaje. And Doc, thank you so much for joining us this morning on the AM show. We understand that starting 1st December, the National Health Insurance Scheme will cover dialysis treatment. But first of all, you tell us what's the brief on this project or this policy?
So let me extend greetings to Ghanaians, especially staff from the NHIA. So I think last 6 months, we started a pilot of this free dialysis. We really wanted to know the data, and we wanted to be informed by the data and going forward what we could do. So we came up with the pilot giving 8 sessions for children below the ages of 18 and below, and adults 60 and above. They were having 8 sessions. Then in between, that's 19 to 59, we were giving them 2 sessions. And we had an approved budget from Parliament where we also added our corporate social responsibility budget to it. And the numbers that were given to us by the Association of People on Dialysis actually seems to be in obviously deviation from the actual. The numbers that were given to us were around 690 something, almost 700. But the actual numbers that we got in the pilot was around 400, which was about 395. So we rounded it up to about 400. Now, with this, we now started our modeling whilst doing the pilot to see if indeed the National Health Insurance Authority can take up the cost of the dialysis. So we looked at certain indicators. So the first thing we did was to look at the prevalence rates of people suffering with kidney disease in the country, or end-stage kidney disease. We got 2 research papers. One put it at 24 people per million population. The other put it at 38.8 per million population, so basically 39. So in doing, it's just a simple calculation. So if 24 is to a million, how many in terms of 33 million population will we get? So when we did that, we got around 800 or 804. So we put it around 800. Then we looked at the 39, that is the 38.8. We look at the 39 people per million population. And when we did that, we got about 1,200 and over. So we looked at the prevalence as between 800 to about 1,200 as the number of people suffering from this end-stage kidney disease.
Right.
Now, if you look at our actual, which is the 400 that we got, now Parliament has already approved 4,914 as the cost of dialysis in the country, so we cannot go above. So we use the 400 and you multiply that by the 490 by the 8 sections that we offering. That gives you about 1.5 million per month for the 400. Then when you just suppose that to 12 months, you get about 18 point something. Then we rounded that up to about 20 million. Then in modeling, you use scenarios. So we went to, what about when you start and the number doubles? So we added another 400. So it became 800 for the second scenario. So 800 by the 490 by the 8 sessions gives you about 3.2 million. When you just suppose that and multiply that by 12 months, you get about 39.6 million, which is about 40 million.
Monthly.
So the second scenario, we put it at 40 million.
Yeah.
Then you look at the third scenario. The third scenario is, what about if you start and it's 3 times the number of the actual, which is about 1,002. So you multiply the 1,002 by the 490 by 8 sections, you get 4.7 million per month. When you multiply that by 12, you will get 56.4 million. So we rounded that up to about 57 million. So if you look at the prevalence, as I indicated initially, which is even the 24 to the 39 patients, which was between the 800 and 1,002, it still corresponds with the actual scenarios that we have used. So regardless of the situation, we've modeled it to minimum and maximum,
right,
looking at between 400 to 1,002 patients.
okay.
And we can now confirm that the NHIS will need a minimum of about 20 million to 57 million annually for this dialysis program.
Are you confident that...
At,
okay, you land on your point and I'll come in.
Yeah, so when we looked at it, then we look at where would we get this funding from? Mm-hmm. You remember initially I told you that Parliament approved some funds for us and we leveraged on our corporate social responsibility. In fact, the funding of the pilot was unique. We did what we call the global budget. So we gave the global budget to some of the facilities or those facilities partaking in the pilot to spend. As we speak now, they've not even been able to spend the monies we gave them. So, which means that we still have some balance left. We have about 2 million left because we budgeted for about 4.4 million. And they've not even been able to use the 2 million. So, which means that if we start on the 1st of December to roll out, we will still have about 2.2 million to play with. Then in our 2025 budget on vote of accounts, at the end of the currently, the finance minister has allocated about 2 billion for the next 3 months for us, from January to March. What this means is that we're getting about 600 million per month, or just above 600 million. So if you just suppose that to 12 months, our budget is supposed to increase from 6 billion to about 8-point-something billion. Now, so that's the first scenario we did. So there's no problem in terms of sustainability or anything. Then we looked at the second model, which is...
Doc, if I may just...
Can you hear me now?
If I may just interject.
This is Benjamin. You say there's no... That was actually going to be... Can you hear me, Doc?
Wait, Benjamin, let me finish with my presentation so that you can come in, because I'm here to give you a very important
We don't have that much time. That's part
you.
of why I am interjecting, but you go ahead.
Okay, but that's point. Let me complete that point because that's very important.
Right.
So we looked at the second scenario in terms of the funding source. Then we noted that we are capped at 20%. So if you are capped at 20% and you use that in modeling, our current budget is 6.8. So what this means is that it's simple calculation, 20 over 100 by the 6.8, that gives you about 1.3 billion more money coming in. So in 2025, regardless of the situation, if you look at both manifestos of MPP and NDC, we know that 1.3 billion will be coming in. So with this, we are confident that it is sustainable and we will be able to fund dialysis with other provision of equipment as well. Thank you.
So my question was on precisely that, financial sustainability. You are saying that per these permutations and also feeding into the manifesto promises of the two major parties, it means this should, by and large, be covered. Is that to say that if, regardless of which administration comes into power, if this is not handled, you would be surprised, that you would think there's been a glitch in the system?
Sorry, your question again.
I am saying that per these projections you've just put there, you'll get some 1.36 billion or so coming into the kitty. Would you then be surprised if either one of these political parties, let's assume it's the MPP or it's the NDC, and we are not able to follow through on this beat of paying for kidney-related issues for free? Would that surprise you? Would you say there's a problem with the system?
Well, once we add it to our benefit package, no government can take it off. And let me tell you something. The fact of the matter is that's why I gave you the two scenarios of the funding. And I've looked at, like I said, we looked at we can do internal, obviously, internal rearrangement of our budget, as long as our primary aim is to pay claims, and our primary aim is to look after the vulnerable. So once we have actually looked at the numbers and we believe that we can fund it, we will be able to fund. And this will be added to our claims budget. And I gave you how internally we can juxtapose that to obviously what will also happen in future. So all that I'm saying, regardless of the two scenarios, we will have money to fund without any problem, and it will be sustained.
Let me just a quick follow-up point. So if I asked you this, if in the current form, if we hold all things constant, let's assume no population increments and all of that, and we hold everything constant for 10 years, you're saying we should be able to do this for 10 years, holding everything constant as it is now?
Yes, absolutely.
Okay.
In fact, we did that. We did the projections as well. And this is what I'm telling you. So if you look at our main source of funding, it's from the NHIA, okay? So as long as taxes are performing, then you expect to get more money. And this is what has been happening. That's why I was able to give you that. I was able to tell you that from next year, our budget will increase, regardless of the situation, to about 8-point-something billion.
All right, thank you, Doug. So, before we let you go, though, starting 1st December, those who are going to be benefiting from this policy, what do they need? What is required of them before they get access to this free dialysis treatment?
Oh, thank you. So we are preparing so hard in such a way that everyone who deserves to benefit from this will obviously get the service. But as you know, dialysis is a specialized disease. So we have some centers that will be providing this service. So we have currently listed about 40 of these centers that our patients will be able to go through. And we are engaging them on Tuesday in such a way across the country, in such a way that they will provide this service for our clients. So
the fallout from that meeting is, letting them understand where they'll get access to the free dialysis and what else would be coming out of that meeting.
Yes, so we'll we'll be detailing them with a plan, and also bear in mind, like I said, the pilot, so it's just continuing. So it's not something that is going to start new. So at least we have a base. So all we're doing is that we're going to meet with them with the implementation plan and how they will claim their monies, and because we'll be adding on new facilities as well. And this includes public and private, because bear in mind, NHIA is with credentialed private facilities as well.
Yeah.
So we've done the assessments and we know which facilities will be carrying out this dialysis from the 1st of December.
All right. Thank you so much, Dr. Dacosta Abuaji. That's the CEO for the National Health Insurance Authority. And we're looking forward to the fallout from that meeting tomorrow.